And so we're going to now, similar to what we did in the first session, we'll start by sharing a couple of survivor stories from from friends and colleagues. So Rachel Cruz will provide some comments first, and then Anna Brewster to follow. Rachel?
Pretty sure no one's going to be able to see me over this podium, but that's okay. I'll do this one. Does this work?
Yeah.
All right. Yeah, well, thank you, Dr. Gershwald, and thank the organizers and AIM at Melanoma for putting the symposium together, and thank all of you for spending your Saturday morning here. I appreciate it. 7 years ago, I knew nothing about melanoma. It's really difficult to overstate my level of ignorance. I knew it was kind of the skin cancer that you didn't want, and that was pretty much it. We had just moved to Houston a few months earlier, and as you do whenever you move to a new city, you need to find your dentist, you need to find your primary care physician, you need to find a good handyman. And in our case, I needed to find an OB-GYN because we knew that we wanted to start a family, and it was kind of time to get the ball rolling with that. And so a few months later, I was in for an annual exam, and my gynecologist said, you have some lesions that you may want to get taken, have somebody take a look at. And I thought, oh, those have been there forever. I don't really need to worry about that. So I kind of smiled and nodded and kind of put it to the side. Fast forward a few months after that, at that point, we knew that we were expecting, and we had gone to Barnes & Noble and kind of bought out the what to expect when you're expecting section of the store. And among the books that I read was a book that said, monitor your skin lesions. They have a tendency to change during pregnancy. And I've always been a bit neurotic or vigilant about health issues. So I thought, all right, maybe with her words in my mind, I thought, I've never seen a dermatologist. Maybe now's a good time to go see one. And so I got some recommendations and went to see one and said, listen, my OB-GYN said I should take a look at these. And she says, I'm not worried about those, but you have something else that bothers me. She says, and I think we should kind of take a shave biopsy and send it off to the lab. And she did that and called back about 3 days later, late on a Friday afternoon, which could be the worst possible time to receive not so great news, and said, listen, I have bad news. It came back positive for melanoma. There are positive margins, and you're pregnant. We can take care of you here. And to this day, I give her credit for this. She said, we can take care of you here. She says, we're going to get a whole other level of care if I just send you on down the road to MD Anderson. And I'm forever grateful that she did. It was not a fun weekend. We had planned this lovely weekend in the Hill Country. And we ended up going because we didn't want to lose the money, but it was just a total disaster. But then that Monday or that Tuesday, I got a call from MD Anderson saying, we have you set up for an appointment with the wonderful Dr. Gershwald. And so 10 days later, I was in to see him. We had a plan, and I had surgery maybe a week later. We had sent out biopsies, came back negative, did the wide excision. Everything came back fine. About 5 months later, we had a healthy baby boy. So a happy ending to the story. But following that care, there were kind of a couple of overarching issues that I realized I needed to contend with. And the first was how to prevent it from happening again, to the extent that you can, because you just, as much as you try, you can't. All you can do is minimize risk. You can't totally prevent things from occurring. And not just reducing the risk of recurrence for myself, but how to minimize risk for my loved ones. My husband, my incredibly stubborn mother and grandmother who grew up in the Florida sun and just didn't know anything different than that, how to help change their behaviors, and how to instill good habits in our young child and now young children was the first issue. And then the second was how to turn what was a distinctly non-positive part of my life into something positive. How can I turn this experience into a way to channel it into a way to help others? And along the way, I found myself grappling with some other issues that I didn't think that I would be contending with. One was, I don't know if the proper phrase is survivor guilt or trouble kind of considering myself a survivor per se. I always had this apologetic tone of, oh, I'm only stage 1. And it was kind of this sense of, my situation wasn't as bad as yours type thing, and kind of not really knowing where I fit into in the survivorship continuum. And then there was also a sense of frustration with the lack of understanding of the disease. How many times I had to deal with, when people would see me, applying sunscreen on our red-headed, fair-skinned, blue-eyed baby. He's just a little boy. He's bound to get sunburns. That's just part of childhood. I would hear it over and over, and I would say, no, it's actually not. These are behaviors that we can change, and that I'm doing my very best to instill good habits at a time when he still listens to me, and so he won't grow up knowing anything different. But it was a challenge. And there was definitely, I like Dr. Nelson's anxiety management. I happen to also see Dr. Nelson, and I'm sure that I must be one of the patients that she's thinking of when she made that comment. But the fear going in every single time and worrying, is there something new on my skin that I've missed? Is there, am I at higher risk of developing another melanoma? Can I see you every month? I think the answer is no, by the way. But oh, that's so sweet. Well, will somebody see me every month to make sure to give me some peace of mind? No, but one of the lessons for me was know your own body. Know what's going on so that you're in a position to be able to say, you know what, I noticed something that's not normal. I do want to get this checked out. Risk reduction has kind of played a really important role in my life since diagnosis. We try to eat well, we try to stay active, we try to get sleep. At the moment, we have a 6-month-old at home, so some of those things aren't occurring as much as I would like. But really, it's implementing sun-safe habits that has become kind of a bit of a religion in our house. Much like Dr. Nelson, you can't walk 10 feet in our house without opening a drawer and finding a bottle of sunscreen. We wear long sleeves much of the time. In the summer, you will, especially in the summer, but most of the year, you won't see us out except in the early morning hours and then in the later afternoon and evening hours when the sun is not quite so strong. We seek shade wherever we can. We still go on beach vacations ourselves. They've lost a bit of their appeal to me personally, but we will camp out with our tents and my ridiculous looking hats. But it's my way to kind of stay engaged and take a proactive approach in my own healthcare, I guess. And as far as how to turn a negative into a positive, I try to get involved in MD Anderson where I can. I've tried to get involved in disease awareness, teaching others about the importance of monitoring their own skin, about taking melanoma seriously, and trying to combat cultural biases against kind of what it means to have a healthy look about you. And that's how I spend my time. Yeah, I'm cognizant that we don't have too much time, so I'm going to pass the baton to Anna.
Great, thanks, Rachel. Anna?
Hi, good morning. As a melanoma survivor, I've really enjoyed learning from all the different presentations this morning, and just thank you to AIM and to MD Anderson for hosting this really great symposium and for the opportunity to tell my story. And I really want to tell a story of prevention and the success of early detection. I feel very lucky, like Rachel was saying, that my melanoma was detected at an early stage. And I was diagnosed with melanoma almost exactly 4 years ago today, in 2014. And however, I'd heard about melanoma and really feared melanoma since I was very young, because when I was 5 years old, my mother noticed a peculiar-looking little brown spot behind my ear. She recalls it was about the size of a pencil eraser. And she showed my pediatrician at my yearly checkup, and he dispelled her fears, told her it was probably nothing, that she shouldn't be worried about it. But with a mother's intuition, she knew that it was something. And so that something turned out to be a dysplastic or atypical mole, and nothing to be too concerned about, but combined with my pale skin, reddish hair, and freckles, it definitely put me at a higher risk for melanoma. So following that, I visited the dermatologist every year, and I learned the ABCDs of melanoma, just knowing that asymmetry, border, color, diameter, evolving to look for those in my moles. And as an active child, I liked being outside, I liked playing sports, and so I did get my share of sunburns, definitely to the chagrin of my parents. They really tried to foster those sun-safe behaviors, but I think I often resisted wearing those bulky, long-sleeve, sun-protective clothing. It was hard to swim or to play in, and unfortunately, I was also the palest of all of my friends in high school, and being tan was definitely cool, and being pasty white, it just wasn't. And so in high school, as we were preparing to go on our senior year spring break trip, I did go to the tanning bed with my friends, and I just didn't fully understand that a base tan is not a safe tan, and that's just something I should have been more aware of. But so a few years later, I was home in Houston for a break during graduate school, and my mom noticed a mole on the upper center part of my back, and it really stood out from the rest of my other moles, and it was one of those ugly ducking looking moles. And as when I was 5 years old again, I think my mom's intuition really set in, and she was worried. And so I had this mole biopsied, and I returned to finish my last year of grad school, and a few days later, actually, I can remember where I was walking down the street in Boston when I talked to my dermatologist, and she told me the results, and I had malignant melanoma. And albeit it was a tiny one, it was still melanoma. And she said that she was really surprised, and I was so young. I was surprised too. I was healthy, I was young, and I couldn't believe it. And I called my parents, I told them the news. But I still felt really lucky because it was small and I could easily have it removed. I let my primary care doctor know in Boston that I had been diagnosed with melanoma, and she learned that I was from Houston and was just so excited because that meant that I could go to MD Anderson, and I was really happy to be able to do that. And really, coming to MD Anderson, being a patient here, my entire experience was really incredible. I remember a nurse drawing on a piece of paper just the oval that the surgeon would use to cut the melanoma out of my back, and learned about the staging and all the other aspects there. And a few days later, I had a pretty large bandage on my back, but I flew back to Boston to finish my last semester of grad school. And really, so what this means for me today as a melanoma survivor, exactly like what Randy was saying on the previous panel, I think it really was a turning point for me. I now know that when I'm at the beach, I have to be the person that's under the umbrella and wears my sunscreen, has sunglasses on, and I go to the dermatologist now not once a year, but twice a year. And I know that melanoma will be a part of my life really forever, and I have a scar on my back that's really that physical reminder of that also. And I've been really excited to see, with the help of the Surgeon General's call to action to prevent skin cancer, it's clear that a lot of the cultural norms around sun safety are changing, like Dr. Nelson was alluding to. And I'm very glad to see that the technology and the fashions around UV protective clothing have definitely improved. You no longer have to look like a dork at the beach in that bulky clothing. And it seems like every outdoor clothing store now has some protective clothing that they sell, and there's Disney characters on sunscreen bottles. And on a professional level, I work in cancer prevention here at MD Anderson. I'm part of the Cancer Prevention Control platform here, and have the pleasure of working with Dr. Gershenwald and others on a lot of those initiatives. Kelly alluded to the policies around tanning bed legislation, and I was really excited to see that Texas was the fourth state in the US to enact that legislation, and it could have prevented me and many others and helped reduce our risk of melanoma. And so I hope that my story and Rachel's story and so many of the other survivor stories that we hear can continue to support and inspire us, and hopefully someday we can eliminate this terrible disease. And thank you.